When we talk about health, what usually comes to our mind? Maybe a medical report, a healthy blood pressure, a normal test result, a body without disease. As a student interested in biology, I believed health was something that could be measured, observed under a microscope, represented by numbers. Science gives us the impression of something very comforting: certainty. And in many ways, this understanding is correct. Modern medicine has saved millions of lives. Vaccines, antibiotics, and surgery have changed human history. But this summer, during my field research in Liangshan, Sichuan, I realized that this definition of health might be incomplete, because sometimes the most important parts of a person's health are the parts we cannot immediately see. I traveled to a Yi ethnic community in Liangshan to study the living conditions of elderly people there. I assumed fewer hospitals meant worse health. I assumed traditional practices were something people would leave behind as society developed. I was not looking at the whole picture. At first, I looked at this room through the eyes of someone who grew up in a city. I noticed what was missing: the space, the comfort, the modern facilities. Some families lived in houses only about 10 square meters. But I did not yet notice what was still there. Inside that same small space, there was a kitchen, a bedroom, a study area for children, and sometimes even several chickens walking around. In many houses, potatoes were everywhere, stored inside the same room where the family cooked, slept, and where children studied. The harvest was both food and a symbol of their connection with the land. One elderly person I interviewed was 78 years old. A local firefighter translated between us. I was sitting only a few meters away, but his world had separated from mine. Before I could study their health, I first needed to learn how they understood life, through their words carrying memories, values, and ways of thinking. Their lives were far from easy. Even in their 80s, many elderly people were still working. They took care of grandchildren, planted potatoes and buckwheat, and some even continued taking sheep into the mountains. Their lives were very different from the retirement life many urban people imagine. They were not simply working because they had no choice. Many of them saw these responsibilities as proof that they were still needed. Their daily lives were still connected to labor, to family, to the land they had lived on for decades. If the connection failed to sustain, in this village will choose to end their lives themselves. This is a story from Mr. Wu. My father has a grave illness, and at his 70s, he passed away silently at home. He rejected my request of taking him into town just a few months before he had gone, and refused to eat or drink for several days. He could barely move, thinking himself as lost of value. So, before this conversation, I thought fear of death is universal. But when I asked elderly people whether they were afraid, their answer surprised me. Many did not see death as an ending. They believed they would finally reunite with relatives who had passed away. They believed their children would continue to care for them. For them, aging was not something that happened to one person. It happened within a family. This also changed the way I understood Bimo. Before my research, I wondered, why would people turn to traditional rituals when modern hospitals exist? But after listening to their stories, I realized I had been asking the wrong question. These rituals were not replacing hospitals or medical treatments. Instead, they created a moment when families could gather, express care, and accompany someone through uncertainty. They answer the question that medicine alone sometimes cannot answer. How can we help someone feel less alone when facing suffering? The elderly people I met still face real hardship. I am not romanticizing their lives. What changed was not my opinion about which place was healthier. What changed was my understanding of what health actually includes. Well, as someone studying biology, I started thinking about this experience from a scientific perspective. In recent decades, researchers have increasingly discovered that our bodies and minds are deeply connected. When a person experiences long-term stress, the brain activates the body's stress response. Hormones such as cortisol can affect sleep, immune function, metabolism, and even the way we perceive pain. Health is shaped by what we feel. A person who feels lonely for years may not have a visible injury, but their body can still carry the weight of that experience. Loneliness is invisible, but it can leave a mark. Like a shadow, it follows someone even when nobody else notices. This idea helped me understand something I observed in Liangshan. The elderly people there were living in difficult material conditions, but many of them had something that is often missing in modern discussions of health: a strong sense of belonging. They were surrounded by family members. They had neighbors who shared the same experiences. They had a community that understood their language, traditions, and memories. Their lives were not easy, but they were not necessarily facing aging alone. And this made me realize that health is not only determined by what we have, it is also shaped by what connects us. After returning from Liangshan, I began thinking about a very different place, Shenzhen. Modern hospitals, regular checkups, advanced medical resources. From a medical perspective, a huge advantage, but urban aging has created another challenge, a quieter one, harder to detect: loneliness. In a city with millions of people, some elderly individuals spend most of their days alone. Their children may be working long hours. Their neighbors may change frequently. Their communities may become less connected. A person can live in a high-rise apartment with elevators, clean floors, and modern facilities, yet still experience emotional isolation. This contrast made me think of something. Sometimes, poverty creates visible problems, but loneliness creates invisible ones. And invisible problems can be just as important. This is why I think the future of healthcare should not only focus on extending human lifespan, but because living longer does not automatically mean living better. Today, medical science has achieved incredible progress. We can replace organs, treat complex diseases, develop technologies that were unimaginable generations ago. But as we become better at adding years to life, we also need to ask, what kind of life are we adding those years to? Perhaps the answer is not simply building more hospitals or developing more advanced treatments. Of course, those things matter, but health also happens in places that do not look like hospitals. It happens around a dinner table when an elderly person shares a meal with family. It happens during a conversation with a neighbor. It happens when someone feels that their experiences are still valued. Healthcare is not only about repairing what is broken. Sometimes it is about protecting what makes life meaningful. This idea connects with a broader understanding of health proposed by World Health Organization. Health is not merely the absence of disease, but a state of physical, mental, and social well-being. But for me, this definition became real only after meeting those elderly people. Before going to Liangshan, I thought I was going there to study what they lacked, but instead, they taught me something about what they had. They had stories, they had relationships, they had a sense of where they came from and where they were going. I still remember that 78-year-old man sitting in front of his house. I remember the firefighter translating his words. I remember looking around and seeing the simple room behind him. A room that contained almost everything in his life. The place where he cooked, the place where he rested, the place where his grandchildren studied, the place where generations of his family had lived. At first, I saw that room through the eyes of someone studying living conditions. I saw what was missing. But later, I realized I had missed something. That room was not only a physical space, it was a place full of memories. Maybe this is the biggest question I learned. Science gives us powerful tools to understand the human body, but humans are more than bodies. Behind every medical number is someone who has lived, worked, struggled, and built a life. So perhaps the question we need to ask is not only how can we help people avoid illness? Perhaps we should also ask, how can we make sure people feel that their lives are still meaningful as they grow older? When I think back to that 78-year-old man, I no longer remember only the small room behind him. I remember the fact that he still had a place in the lives of others. Because in the end, health is not just about the years we add to life. It is also about the life we add to those years. Thank you.